Hi everyone, today we talk about the effect of calcium intake to the risk of kidney stones. Calcium oxalate is the most common kidney stones, which takes about 80% of all types. It is common sense that you don't want both calcium and oxalate excretion at high level. So it seems reasonable to assume that the restrict calcium intake will lower the risk of kidney stones. The answer is opposite. Higher dietary calcium is associated with lower risk of incident kidney stones. Let's have a look at the result of 3 large cohorts. They covered more than 220,000 people during combined 56 years of following up. 5,270 incident kidney stones were documented during the studies. But throughout a comparison between the diet of patients and healthy participants, it concludes in men and women, higher dietary calcium from non-dairy or dairy sources is associated with the lower risk of incident symptomatic kidney stones. Why does this inverse association happen? It is because calcium is the most potent modifier of oxalate absorption. Calcium intake will decrease oxalate absorption in GI tract and leads to decreases in urinary oxalate excretion. Here is a paper talking about dependence of oxalate absorption on calcium intake from Germany in 2004. Let's go directly to their conclusion. Reducing intake from 1,200 to 400 mg calcium per day increases the absorption of dietary oxalate by 5-fold. GI oxalate absorption depends linearly and strongly on the calcium intake up to 1,200 mg calcium per day. The resulting increased urinary calcium excretion did not heighten the risk of crystal formation. Additional calcium beyond 1,200 mg reduced oxalate absorption further, but only marginally. This conclusion gives us two important information. One, 1,200 mg calcium a day is the most effective number to decrease oxalate GI absorption. In 2016, FDA increased the daily value of calcium from 1,000 mg to 1,300 mg. I think this research provides some scientific support for the number change. 2. Even though the calcium intake will increase urinary calcium excretion as expected, the increase does not escalate the risk of kidney stones. To understand this, let's have a look at the concentration of calcium and oxalate in urine. For calcium, it is about 5 millimolar every 24 hours. For oxalate, the number is 0.3 because urinary calcium is large excess than urinary oxalate. The kidney stone formation is more sensitive to the concentration of oxalate, not calcium. There are many calcium-rich foods on the table, such as milk, cheese, yogurt, cereal, energy bar, and sardines. There are also some leafy greens rich in calcium, but they are also rich in oxalate, such as Swiss chard, spinach, and kale. People with hyperoxaluria might want to limit the intake of these grains. Calcium is the essential nutrient for people, especially for elderly people. Restriction of dietary calcium is not supported as means of preventing calcium kidney stones. On the contrary, enough calcium intake will maintain a good health condition and lower the risk of calcium oxalate kidney stones. This is all I have today. Hopefully, this can be a little help for your health. If you are interested in my topics, please click the like button and subscribe my channel.